When our patients are dying, they need us more than ever. We, as a healthcare community, cannot abandon them at that point.
Often in medicine, the patient's voice and the family's voice are never heard.
Caring should be as much an integral part of medical student resident education as cure.
Providing the very best pain and symptom management and family-centered care.
And there's no way you're going to practice medicine without impacting that family.
I want to welcome you to this opportunity to meet 5 extraordinary physicians whose ability to care for patients, including patients near the end of life, has been exemplary. These are this year's recipients of the Hastings Center Cunniff-Dixon Physician Award.
These are physicians who are leaders in their clinical settings. They see the patient as someone who they need to care for in body, mind, and spirit.
It's not really about palliative care. It's about good doctoring, and these folks are doing some mighty good doctoring.
We are fed by patients if we can open our hearts to them. I had ovarian cancer 6 weeks after I started my practice. At first I was just dealing with the surgery and the chemo and all the other things that were going on, but somewhere a month or 2 into it, I had to admit to myself that this might be a terminal illness. The great gift that gave to me was that I could sit down and talk with patients who were worried about dying, and I wasn't afraid myself.
I came to Duke in '89 and did a fellowship in geriatrics. I was 50 before I learned to shut up. And God, that's powerful. So when a Hispanic family is talking to me and I have to have an interpreter and they start quoting, or they even point their finger at you and say, we are people of faith and you are a person of science, it is so comforting to know, just sit there and listen and don't shoot them down. Allow them to be who they are.
Tony has this uncanny ability to look in the eyes of old people and make them feel that he's connecting perfectly with their humanity.
We focus so much on teaching and learning and practicing cure, but we don't focus that much on teaching, practicing, or learning about care.
When we work with the subspecialists in our institutions, other healthcare providers in our institutions, primary care physicians in the community, agencies, home health agencies, hospice agency in the community, all together, putting the child and the family at the center, then that's the good care, good model of care.
Dr. Widera was nominated not by another physician, not by a professional colleague, not by the head of the division or the hospital, but by a member of a patient family. Not a grateful patient, but a grateful loved one.
Everyone in this room shares this common belief and passion that death and dying is as, or is more important than many stages in life. And that as healthcare professionals, as family members, this is something that it's very important to focus on.
The importance of the Hastings Cunniff-Dixon Physician Award is that it puts a spotlight on our profession of palliative care. And it's ever so important to be in the same room with administration, with leadership, with colleagues. I'm very optimistic that this will be a big push for the development of our program, not only here in the Twin Cities and the Upper Midwest, but really nationwide and internationally.
I hope you will help us identify and recognize and reward those physicians who are providing outstanding care at the end of life.